So how many people here believe we as a society are defined by how we care for the least among us? Unfortunately, the person we're here to say that to doesn't seem to agree with that. And I come before you as an oncologist who has seen far too many of my patients go bankrupt strictly because they developed cancer. I come before you as an oncologist who's seen too many patients of mine from communities of color who present with late-stage cancer strictly because they couldn't get the proper screening and preventative services. So when we talk about the least among us, these are my patients day to day, these are your neighbors, these are your family members. Despite, and now you have a Republican Congress that over 60 attempts at repealing the Affordable Care Act are finally going to get their way. And this is going to decimate California. It's estimated that upwards of 4 to 5 million people are going to lose health care coverage if the Republicans have their way. Now, despite the tremendous good that the Affordable Care Act did, it should be pointed out that even if the Republicans don't repeal the Affordable Care Act, 2.9 million people in the state of California will remain uninsured, and 29 million people will remain uninsured nationally in our country. It will also be pointed out that there's still too many medical-related bankruptcies in our country, and especially in the state of California. It should be pointed out that we have an immoral and unjust system where 1/3 of people that have insurance will delay seeking care strictly because they cannot afford the co-pays and deductibles. We have an immoral system where 1 out of 10 seniors will forego taking drugs because they cannot afford the cost of the prescription medication. And we have an immoral system that refuses to take care of our undocumented brothers and sisters. So we are all in this together to say that not only do they need to keep our hands off Medicare, the Affordable Care Act, and Medicaid, but we need to do even better for all of our families and our brothers and sisters. Now, ironically, if the Republicans have their way, we are going to have major problems in the state of California. It's estimated that we're going to have a $20 billion shortfall. And already there's talk in Sacramento that we may have to increase taxes for everyone 25%. First of all, that will probably not get 2/3 majority. So with the other choice is to eliminate 4 million people from the Medicaid expansion. And people in this district especially need to realize, of all the districts in the state of California, Kevin McCarthy's district probably had more people qualified for Medicaid than any other district in the state of California. It is estimated that 77,000 of his district constituents will lose health care from the Medicaid expansion alone. And the other thing that you need to realize is the Republicans, while they have not given many details, they have said that they're going to be able to give states more leeway to require drug testing and work requirements. Well, here's an idea. If you look at the number of days Congress worked last year, Kevin McCarthy only worked 111 days. That's not full-time work, so let's start by taking away his health care first. Finally, as we try to figure out how to not only protect our health care coverage, but make it better, the $20 billion shortfall, I have a great idea. Back when Sheila Kuehl passed her single-payer bill only to be rejected by Governor Schwarzenegger, the people in Sacramento did a complete budget analysis and hired a nonpartisan group called the Lewin Group. And that showed back then in 2006 that in the first year alone, a single-payer Medicare for All plan would save $20 billion. Isn't it ironic that that's what we're talking about what the shortfall is now? Yes. And it should also be pointed out when people say, well, we don't have any money. Well, there was a study last year done by UCLA that showed 70 cents of every healthcare dollar spent in the state of California already comes from taxpayers. Coupled with the fact that the private insurance industry takes anywhere from 20 to 30 cents of every healthcare dollar away from actual patient care for exorbitant CEO salaries, marketing, administrative costs that are only designed to deny our care. We're essentially paying for universal health care. We're just not getting it. So you have to ask yourself, since 2006 and 2008, when the bill passed twice, why has there been no movement in Sacramento? Why has there been no movement to regulate insurance rates? Why has there been no movement to regulate drug costs? And why has there never been another single-payer bill? Yes. So I got in a lot of trouble for using a term which I won't use today, and I apologize to anyone that was offended. But I will say this. We have a legislature that remains beholden to the private insurance industry and pharmaceutical industry. The only way we create a healthcare system for the people is by the people. We raise up today, we hold every elected official accountable, and we recommend that if they're going to raise taxes, they be used for a healthcare system that ensures everyone, including our undocumented brothers and sisters, provides coverage. And at the same time, we can do this. We can do single payer. We don't need to pay any more money, but the political will is not up there. It is here, and we start today. Thank you very much.